I'm Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. Fertility treatments usually begin on day 2 or day 3, and it's very important to listen to your clinician's advice and start the treatment or investigations on these days. Sometimes day 4 or day 5 is also okay for starting intrauterine inseminations and other treatments, not IVF, but other treatments like ovulation induction and timed intercourse. But it's always better to start on day 2 or day 3. So let's try to understand why. To understand why, we have to go into the natural physiology. In natural physiology, day 2 of your period cycle is when all hormones are calm, and at this stage the ovulation stimulation begins for the next cycle, which means that follicle stimulating hormone, luteinizing hormone are released by the pituitary gland at the hypothalamus in the brain, and these begin to signal to the ovaries to grow the next batch of eggs for the next period. So in this batch of eggs, the egg which is the strongest takes the most signals of FSH, and with an LH, luteinizing hormone rise, it is released. So on day 2 or day 3, we get to know what is the antral follicular count, the number of eggs, the group of eggs that has been selected to grow for this cycle. According to your age, is it okay? Is it about 5 to 8, 5 to 10, 8 to 20, or are you polycystic ovarian with this disorder? Then do you have more than 20? Do you have multiple cysts in your ovaries? All these are estimated on day 2, and it's very important. So when we do a day 2 scan, we are also looking at your endometrium, which means that when day 2 bleeding is happening, the whole endometrium begins to shed, and it is thinner than what it is during the luteal phase, when the egg has ovulated before the period. So it's very important for you to get yourself assessed on day 2 and also begin the treatment somewhere around this time. What are the investigations? Usually bloods, like I said, follicle stimulating hormone, luteinizing hormone, estrogen, progesterone, inhibin, all these are investigated. Along with these, although they are not related to day 2 of your period, thyroid, anti-Mullerian hormone are also investigated. Then when we come to treatment options, ovulation induction and timed intercourse can begin from day 1 to day 5, day 6 also, because the medications are given to make the egg grow and release the egg. When the egg is released, you are asked to take part in unprotected intercourse for a better chance at pregnancy. For ovulation induction with IUI, intrauterine insemination, medications are given, the egg is released, and your partner's sperms are processed in the laboratory, put back into your uterus to increase your chances of pregnancy. For IVF, it is essential to begin the treatment on day 2 or day 3 of your period cycle, because that is when these hormones, when injected, act best on your ovaries. Because in IVF, extra hormones, the brain is already producing FSH, but extra externally hormones are given to make the eggs grow. Now that you understand the importance of day 2 or day 3 scan or treatments, it's better to start treatment around that time. If you wish to understand more, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.